Hello, I'm Dr. Maruthappu. I'm a clinical research training fellow funded by the Medical Research Council at the Blizzard Institute, Queen Mary University of London in David Kelsall's group, and I'm also a consultant dermatologist at Barts Health NHS Trust, and I am the lead researcher in this paper that has recently been published in the British Journal of Dermatology entitled Loss of Function Mutations in Desmoplakin Associated with a Skin and Hair Phenotype. So the reason that we did this study is that we were interested to see whether dominantly inherited arrhythmogenic cardiomyopathy was associated with a skin and hair phenotype. We know that rare recessively inherited forms of arrhythmogenic cardiomyopathy are associated with curly hair and a palmoplantar keratoderma. And this really helps with making the diagnosis. So because arrhythmogenic cardiomyopathy is a leading cause of cardiac death in young adults, we thought it would be extremely useful to see if there was an associated skin and hair phenotype. So what we did, we worked very closely with our colleagues in cardiology at Barts Heart Centre, and we examined patients with loss of function mutations in desmoplakin that were inherited dominantly, and we looked at 38 individuals from 6 separate families. And what we found was that many of our patients did have an extremely obvious curly hair phenotype, as well as, in some individuals, a palmoplantar keratoderma. And this was really striking to the extent that you could go and visit the heart centre and you could spot the patients in the waiting room because their curly hair was so obvious. So this was really interesting. So what we also did was we took some biopsies from these patients from normal looking skin on the forearm. And when we examined these biopsies, despite the fact that the skin was normal, we found that there were mislocalization in important desmosomal proteins such as desmoplakin, plakoglobin and connexin 43. And the cardiologists were particularly interested in connexin 43 because it's very important in electromechanical conduction in the heart. So this was the first time that this has been shown, and really this could be quite useful as a diagnostic tool helping to diagnose arrhythmogenic cardiomyopathy. We also undertook further investigations extracting mRNA from these biopsies to determine that the underlying mechanism is haploinsufficiency. So taking all these findings together, our conclusions were that there is a skin and hair phenotype in some patients with arrhythmogenic cardiomyopathy related to desmoplakin, and importantly that the underlying mechanism is haploinsufficiency. So at the moment we're working towards adding the skin and hair phenotype to the task force criteria for the diagnosis of arrhythmogenic cardiomyopathy. Thank you for your interest in this paper.